Hi there. Thanks for joining us on our program To Your Health for our premiere episode. I'm your host, John Lazarou, and To Your Health is a monthly program where you, the viewers of us on Facebook Live, will be able to send in your questions to a GBMC physician, and our goal is to try to keep you as healthy as possible. Joining us today is Dr. Kevin Ferentz, lead physician over at our Owings Mills office for GBMC. Dr. Ferentz, thank you for joining us. We're going to talk today about sunscreen and melanoma. And Dr. Ferentz, you bring a unique perspective, which we will get to later on in our program. But I want to talk to you. You know, we were talking earlier. We said, you know, the summertime is awesome. People go on trips. They visit the lake. They go to the pool. They go to the beach. And the one thing that we look at is, you know, we put the hat on our head. We put the sunglasses on. You know, we wear that light clothing, right? But the one thing that we neglect is our skin. Why do you think that happens?
Well, I think people just think, hey, if I'm outside, I get a little color, maybe I'll look good and I'll be healthy, and they don't think about the damaging rays of the sun that are causing real problems to them.
Well, now let's talk about damage, okay? We talk about skin cancer, we talk about melanoma. So what is skin cancer? What is melanoma? And we were talking earlier that there are different kinds and different types.
Correct. So there's basically three kinds of skin cancer. There's a couple of more rare kinds, but the kind of skin cancer that we see is basal cell carcinoma, squamous cell carcinoma, and melanoma. Of the three, melanoma by far and away is the most lethal of the skin cancers. And what happens is there are rays of the sun that damage the DNA in a person's cells in their skin, and when that DNA is damaged, it can progress to be a cancer.
Right. Now, earlier, you know, we were also talking again about melanoma. So what are some of the symptoms of melanoma? And we talked about, I don't want to call it an acronym, but the ABCDEs of melanoma.
Right, so we've been talking about that for many, many years. So A, if you have a mole, and if you looked at the average person, we each have about 20, 30, 40 moles on our body if you looked at them. But you're looking for moles that are asymmetric. If you look down the middle, one side doesn't look like the other side. You look at the border. Is there a nice crisp border around the mole, or does the color kind of leach out into the skin around it? C is color. Is it a uniform color? Is it all brown? Or is there black in it? Is there red in it? Does it have different colors? D is diameter. Most melanomas will be larger than 6 millimeters, which is about a pencil eraser. So if you have a mole bigger than a pencil eraser, you might want to show that to your doctor. And then E is evolution. Is it changing? Is it getting bigger? Has the color changed? Is it now kind of scaly? Right. Is it raised? That's a mole that needs to be evaluated.
Now, you just to piggyback on mole and evaluation. So let's say, you know, I'm looking at my skin and I see a suspicious mole, right? Who should I go see first? Should I go see my primary care doc? Should I go see a dermatologist?
Well, of course, I'm a family physician,
right.
And I actually did a fair amount of training as part of my residency in family medicine. In dermatology, every family doc feels comfortable evaluating moles. Many of us, myself included, will actually biopsy a mole. You can do a punch biopsy just like a dermatologist will. If you can't get into your family doc and you want to go see a dermatologist, knock yourself out. It's totally okay to see a dermatologist.
Well, joining us again is Dr. Ferentz from our GBMC Owings Mills office. Please, if you have any questions regarding sunscreen, skin cancer, melanoma, we welcome them. Please send them in. So melanoma, skin cancer, the first line of defense we talk about is sunscreen.
Correct.
Okay? And there's lots of sunscreens out on the market, tons, okay? Let's be honest. It's kind of hard to pick the right one, right? But let's talk about generic sunscreen. Is there any difference between a generic sunscreen and one that might be a brand name sunscreen?
No. They're all under FDA control. Every sunscreen is evaluated by the FDA, and you actually don't have to spend the extra money because of the chemical that's in it. Now, the brand name, maybe it smells a little bit better, or you like the cream that's in it a little bit better, but really the chemical of the sunscreen is going to be the same whether it's generic or a brand name.
Right. If you can see here on our table, we have different types of sunscreens. We have one that's a lotion. We also have two that are spray. So, Dr. Ferentz, let's be honest. Which one's better, spray, lotion?
Yeah, creams, gels, there's a whole bunch of different kinds. So the issue is using enough. I mean, that's the most important part. And there's some evidence that says that people apply less than half of the amount they actually need to apply. So if you're using a cream, you should be filling a shot glass worth of cream. About an ounce is enough to cover the areas of your skin that need to be covered. If you're using a spray, you have to make sure that you're covering enough of your skin with the spray for it to be effective. It can't just be a light little thing. It's got to be a significant amount of spray. And because of some people's concerns about safety related to inhaling sunscreen, you need to be careful about that. You want to be you don't want to be downwind of the spray. You'd like the spray to sort of spray away from you. Don't have an open flame near the spray because they're flammable.
Got it. You know, we talked about, you mentioned how, you know, if you're using a lotion, shot glass amount. But one of the things that many people ask, and one of the questions we got on Facebook is application. How do we properly apply sunscreen? And where are the most vulnerable parts of our body when it comes to exposure to the sun? You know, some people will say it's your shoulder. Some people will say it's your hand. Some people will say, well, it's the back of your neck.
And I'm going to say it's everywhere. Any exposed area of skin needs to be covered with sunscreen. So you need to apply it to dry skin, preferably 15 minutes before you go out into the sun. And then you need to make sure that you're covering it with an adequate amount of the cream, lotion, ointment, whatever you're using, or spray. Then it has to be reapplied. And it has to be reapplied about every 2 hours that you're out in the sun.
Does that include also adults and kids, or mostly kids every 2 hours, or is it a quicker turnaround for children? Or
no, it's everybody. Everybody who's applying sunscreen, it should be applied every 2 hours. And then if you go into the water, you can look at the individual brand, and it may say you have to apply after 40 minutes in the water or 80 minutes in the water. There is no, however, waterproof sunscreen. They used to be able to tout that their sunscreens were waterproof. That doesn't exist anymore. The FDA said you had to stop doing that. It's water resistant, but it's either 40 minutes or 80 minutes.
GBMC's physician, Dr. Kevin Ferentz, joining us today, talking about skin cancer and melanoma and sunscreen. If you're watching us live on Facebook, please send in your questions. We just got a question from Greg. Greg is training for a marathon, and he wants to know, how can runners properly protect themselves from the damaging rays of the sun, because they're out there for a long time, especially on those 10, 13, 15-mile training runs. How do they protect themselves?
So, great question, and actually my son is also a marathoner. So, very important to apply sunscreen before you start to run, and then cover as much of your skin as possible. Make sure he has a hat on. If he can run with the kind of hat that sort of covers his ears a little bit, that would be a good thing. But to cover as much of his skin as he possibly can while he's running. He's not going to stop runners, you know, are insistent about running. Of course, if he gets his time down to less than 2 hours of a marathon, that would be the ideal, because then he'd be able to just reapply.
So when we go, we talked earlier about, you know, people working outside for extended periods of time. We talk about, you know, family trips to the lake, to the pool, to the beach. Let's talk about sunscreen for a minute as far as application at those locations, right? 3 different types of water, 3 different bodies of water. Should we apply more when we're at the beach, more when we're at the lake, more when we're at the pool, or is it, there's really no difference?
It doesn't make a whole lot of difference. If you're exposed to sand, if you're exposed to water, or if you're exposed to snow, snow also reflects sun. So it could be the middle of the winter. If you're outside at 12 noon in the middle of the winter in snow, you're going to get sunburned. So you have to apply sunscreen then as well.
Okay, so let's talk real quick, and then we're going to get to your story, because you have a very interesting story when it comes to this subject matter. Is there any difference between sunscreen and sunblock?
There is. So sunblock actually completely blocks the rays of the sun, or as pretty close to it as it can. In the old days, this was zinc oxide, and sometimes you would see, like, the lifeguard at the pool would have this white stuff on his nose, and that was zinc oxide. It's now prepared so that it's not that thick white stuff, and there's also titanium dioxide. Those are the 2 most common. That blocks sun's rays very effectively. Sunscreen is a chemical that diffuses the rays of the sun, the damaging rays of the sun in your skin. Not as effective as sunblock, but better tolerated than sunblock. So that's why most of us still use sunscreen and not block.
In your explanation just right now, you mentioned a couple of ingredients that were used in the past. When it comes to sunscreen or sunblock, are there any certain ingredients that should be looked at or reviewed when somebody picks up the bottle in the back?
So the most important thing about the sunscreen that you use is that it should be SPF 30 or higher. That blocks 97% of the damaging rays of the sun. It should be a comprehensive block, so it should block both UVA rays and UVB rays, two different harmful rays of the sun. UVA is the rays that cause aging in your skin. UVB is the rays that cause burns, right? That's the easiest way to remember it. A for aging, B for burns. But they both need to be blocked, so you want to make sure that you're buying a sunscreen that blocks both UVA and UVB.
Okay, awesome. We just got a question from Laura. Laura asked the question, does SPF really make a difference? Come on, Doc, does SPF really make a difference?
This is such an easy question, Laura. It's yes, absolutely yes. The only argument you could have is, does it make a difference to use a 30 versus a 50? Well, you'll probably block a little bit more of the sun's rays at 50 than you would at 30. But 30 blocks 97% of the rays, and the American Academy of Dermatology, the American Cancer Society, pretty much all say use a 30, but if you want to go higher, you can.
Right. Now, something that many of our viewers might or might not know is that you bring an interesting perspective, not just as a physician on this subject matter of melanoma and skin cancer, but also your personal experience. You are, and congratulations, of course, a melanoma survivor. How did you find out you had melanoma, and how did you react when you got the news? Because I'm sure you were probably very shocked and surprised.
Yeah, it wasn't fun. It was not a fun day. So I was actually a fourth-year medical student, and I grew up at a time before there were sunscreens. So many, many times throughout my childhood, I had really significant sunburns, and I have had to pay the price for that. And I've not just had a melanoma, I've had a basal cell, I've had squamous cells.
Oh, okay.
So this is an ongoing issue for me because the damage that you have to your skin as a child and a young adult plays out in your 40s, 50s, and 60s with skin cancer down the road. Right. So I was a young man. I was a fourth-year medical student. I had a mole on my back that was clearly changing. We talked about that ABCDE thing. It was evolving. It got bigger, it got scalier, and I thought, it was itchy a little bit, and I thought, I better show this to somebody. And I was doing a dermatology rotation in beautiful Buffalo, New York, where I went to medical school. Showed it to my dermatology attending, who said, it's probably nothing, don't worry. Took it off, and I had a thin melanoma. Right. And so I had to undergo, unfortunately, much more significant surgery on my shoulder. Luckily, I didn't have to have chemo or radiation, and it's been a very long time, and I haven't had a recurrence, but I have had to deal with the issues of basal cell and squamous cell because of all of that damage that I had to my to my skin when I was a kid.
So let's talk about how did that impact your life? I mean, how did it change, you know, the way your quality of life or the way you just went about things, especially in the summertime, right?
So, I mean, I would like to think that because I was a patient right before I became a doctor, right. I've been able to use that to enhance my sensitivity towards patients, my empathy towards patients when they're going through a bad time, and it's always good for doctors to be patients every once in a while because it reminds them of what we're supposed to be doing.
All right. So I want you to do me a favor. I want you to look right at that camera, and if there's one bit of advice or important information you want to tell our viewers as a melanoma survivor, what would that be?
So it's really, really important that you not get sun damage. We lived through century after century of people thinking that skin that was not sun damaged and not sunburned was very attractive. And then something just went crazy about 50 or 60 years ago when people thought, no, I need to be tan and I need to get, sunburns are okay. And people go to tanning booths. Worst thing in the world to go to a tanning booth. So what you need to do is you need to not burn your skin ever. Never, ever let your skin get burned. You need to keep your skin covered as much as possible. You need to wear a wide-brimmed hat and sunglasses because you can get skin cancer in your eye, in the retina. People don't know that. That's why you have to wear sunglasses and apply sunscreen the way you're supposed to.
Well, we appreciate that message. And, you know, we just got a question from Barb. She asked, how often should you get an overall exam, I guess from head to toe, for moles, for suspicious moles?
So I will tell you, it's a controversial topic. The dermatologists say you should do it every single year. I would say if you have any history of skin cancer, no question about it. You should be screened every year by either your primary care physician or a dermatologist. If you've never had skin cancer, I would say that every once in a while, it's reasonable to show your primary care doctor what moles you have and let them take a look at it and see if there's any concern.
Would you suggest during, you know, people having their yearly examination to say, hey, doc, you know, I saw this, can you take a quick look at it, as opposed to saying, it's probably nothing, you know, just let it go?
Yeah, no, I would definitely, if you have any concern about a mole, we would much rather be able to tell you, don't worry about it, than for you to ignore it and find out you have a significant melanoma down the road.
Got it. Well, you talked about, you know, in your personal story, you mentioned about when you were a kid and how, you know, you were exposed to the sun a lot, and that led to a lot of sunburn and so forth and so on. One of the questions we got prior to our show today was, we use SPF 50 to prevent sunburn and skin damage, but my kids still tan, even with reapplication. Are they at risk for sun damage or skin cancer, even though they do not burn?
Yes, unfortunately they are. The UVA rays that are getting through are still going to down the road cause not necessarily skin cancer, but definitely skin damage, wrinkling, the leathery kind of skin that sometimes people get who say, well, I've never burned in my life, I just tan. Yeah, but it's still causing damage to the skin.
And another question that we received was, which sunscreen is good for kids 8 years of age and older?
So actually, any sunscreen is okay for kids. There are some that are specifically designed, you know, for whether it's the cream or the lotion. Any kid over the age of 6 months should have sunscreen applied to them. But prior to 6 months, we just really strongly recommend to not put kids out in the sun.
Okay. So, you know, parents and normally put sunscreen on their kids before they go to the beach or to the pool, as well as adults. But sometimes we neglect to conduct that reapplication. Okay?
Correct. Yeah.
So if you don't reapply and let's say you get sunburn, what should you do if you get sunburn?
Sure. So sunburns should be apply cool, the way you treat a sunburn. You apply cool compresses to the burn. Okay, that's one thing. You can apply moisturizer to the skin. You can use 1% hydrocortisone cream over the counter to your skin. Anti-inflammatory medications work better than Tylenol, so using stuff like Aleve or Motrin or Naproxen or aspirin would be the way to go. If it gets to the point where you have a blister, now that means you've had a second-degree burn. So don't pop the blister. That's one of those common things that people think they should pop the blister. Once you pop the blister, you're at risk for getting an infection in the skin. And if it's significant blistering, you should go see your doctor.
We talked about melanoma, okay, and we're still talking about it, but one of the questions we had sent to us was, is melanoma hereditary?
So the only thing about melanoma that is potentially hereditary is there are sometimes people can have in their family moles that are sort of funny looking, okay, that are atypical is what they're called. Atypical nevi, that's the medical term for a mole, is a nevus. If you have a family history of people who have atypical nevi, unfortunately you're at increased risk for melanoma. That's about the only hereditary aspect of it.
Got it. We just got a question from Kim, and Kim wants to know, are freckles actually damage caused by the sun?
No, freckles are just, in people who freckle, and that was me as a kid, freckles are, instead of having your melanin, which is the chemical that gives you color to the skin, dispersed evenly throughout your body, freckles are the melanin in a package, in a small area. So just because you have freckles doesn't mean that you've necessarily had skin damage.
Got it. So should people that have a lot of freckles be extra cautious? Is there a certain type of skin that should be, like someone who's pale, should they be more, weary about going out in the sun for an extended period of time, or making sure they have extra sunscreen or sunblock on?
Yes, those are all yes.
Right.
The lighter your skin is, the more likely and more susceptible you are to burns. However, African American people, darker-skinned Hispanic people still get skin cancer. You know, Bob Marley,
Yeah, I was just,
right?
we were talking
there you
about
go.
that, right?
Bob
Yeah,
Marley, right, died of melanoma
Right,
from his
of all things.
foot. I have a dear colleague now whose mother, an African American woman who's dying of melanoma. So African American people can get melanoma.
Okay. So does melanoma, it was one of the questions that came in, does melanoma have anything to do with multiple myeloma?
No, two totally different kinds of cancers.
Can you explain the difference? I mean, can you explain what multiple myeloma is?
Sure. Multiple myeloma is a kind of cancer of cells in your bone marrow and has truly nothing whatsoever to do with skin cancer.
Okay. One other question that we received prior to today was, if you had a basal cell removed from your scalp, does this increase your chances of melanoma being present?
So I have had a melanoma. I have had a basal cell carcinoma on my scalp.
Right.
All skin cancers can occur in a person who's had sun damage. So I would say a person who's had a basal cell needs to be careful, needs to have their skin examined to make sure they're not developing melanomas.
Okay. Well, we're getting close to the end of our program today, but we do have a couple of more questions. One, there are some sunscreens out there that are 2-for-1s, meaning that they not only offer you protection against the sun, they offer you protection against those nasty bugs that fly around in the summertime.
Sure.
Are they really effective for both? I mean, are you sacrificing protection against the sun to fight off the bugs, or?
Yeah, here's the bigger issue, is that sunscreen is supposed to be applied in large quantities. Bug spray is supposed to be applied in minimal quantities. So the reason why we don't recommend those combination products is you need to be applying more of the sunscreen and less of the bug spray. And so that's the danger of it.
Sure.
I need to make one more point that I forgot to say before. The damaging rays of the sun are mostly out between 10 in the morning and 2 in the afternoon. So before 10, after 2, doesn't mean you shouldn't apply sunscreen, but it's between 10 and 2 that you really have to be concerned. And if you have a history of skin cancer, I don't go out between 10 and 2 whenever I possibly can.
So let's talk a little more about 2-for-1ers. We talked about bug repellent sunscreen. Is there a sunscreen or something that offers protection against not only UVA but UVB rays?
Absolutely, and we talked about that briefly. So you do want to get a sunscreen that protects you from both UVA and UVB, because even though the B is the one that causes the burn, if you continually get exposed to excess UVA rays, your skin is going to get damaged, and you're going to get wrinkled, and you're going to have leathery skin, and you're not going to like it. You're going to get old age spots.
Right. Well, Dr. Ferentz, you bring a lot of great information to the table, again, not just as a physician, but also as a melanoma survivor. And we really appreciate you taking your time to come here and speak with us today. But before we go, let's summarize. What are the key points that you want our viewers to know about sunscreen and melanoma? And like I said, I want you to maybe just reassure the message as a melanoma survivor. What is that key message you want the public to know?
So stay out of the sun between 10 and 2. If you can't stay out of the sun, make sure you're wearing an SPF 30 or higher sunscreen. Reapply that sunscreen every 2 hours. Try to wear a hat with a wide brim. Cover as much of your skin as you can. Wear sunglasses. If you're swimming, make sure you reapply the sunscreen based on the manufacturer's guidelines, whether it's every 40 minutes or every 80 minutes. And if you have any suspicious moles, lesions on your skin, go to your primary care physician. If you can't get in and you need to see a dermatologist, that's fine. Because if you catch melanoma early, which thank God, mine was a thin melanoma, it is a completely curable illness. If you catch it down the road, about 10,000 people in America die of melanoma every year.
That's a shame.
And that's unnecessary.
That is a shame, because it's preventable, right?
Completely.
I mean, if you just take the time to protect yourself and be wary of the time and how much time and when you're out in the sun, this could be prevented.
Correct.
Dr. Ferentz, thank you very much for joining us. And I want to thank you all on our Facebook Live for joining us today for To Your Health. Join us again next month, August 16th at 11 o'clock, when we talk about sports injuries and concussions in kids. With the fall sports season pretty soon underway, especially when school starts, that's important. It's important for parents to know, and coaches alike, what are some of the signs and symptoms. So join us here on August 16th at 11 o'clock when we're joined by GBMC physician, Dr. James Bruns. You know him, right?
Very well.
You know him. I want to thank you again for watching us. This is To Your Health. See you next time.